I wanted to finish off with a patient testimonial, so I thought it was very important for you to get the actual perspective from a patient who uses pump in terms of her lymphedema management. So I'm going to introduce Elaine Arnush here. Elaine was part of the lymphedema working group, and she played a big role in terms of helping get pumps in the province of Saskatchewan.
Good morning. I'm really glad to see you here. I can't tell you how thrilling it is to actually think that lymphedema patients throughout Saskatchewan are going to be able to get proper treatment in their own health regions. I never thought I'd live to see the day, is what I said to Carla. And we owe Carla a great deal of thank you for her help in having the Ministry of Health actually take this issue seriously. Until she was involved, really, we weren't getting very far. I'd also personally like to thank Tracy and Sylvia and Alyssa, who have helped me so much to turn what was a condition that controlled my life, and in fact I found way more depressing than the breast cancer, which sounds weird, but I'll explain to you why. Really, for me, when I was diagnosed with breast cancer, it looked quite serious. It looked large. I was told I couldn't have a lumpectomy. I had to have my breast removed and 11 lymph nodes, and so I was very surprised and happy to find out that in fact it was stage 1. Looked way bigger in the MRI than it was. I thought I'd won the lottery, right? Diagnosed with cancer, lose the breast, as I told my surgeon, I can live without it, but I didn't count on getting lymphedema. Lymphedema, as I say, was way more depressing to me. The cancer, I was fortunate I didn't have to take radiation. My surgeon, because she thought it was large, took a lot of tissue. I had huge, wide margins that were clear. I was clear of cancer, and I'm 5 years post-cancer, so I'm considered released from the system. But I'll never be released from the lymphedema. And it does, as Tracy says, control your entire life. My son's getting married in Jamaica next month. So what does that mean? I wear this garment, which this pretty much covers it, but it's very hot. What am I going to get to wear that I can wear to a wedding in Jamaica, that I'm going to look decent and everybody's not saying, what the hell is the mother of the groom wearing? And yet stay out of the heat. The wedding's on the beach. How am I going to stay out of the heat? So I'm considering buying a big parasol. It controls everything you do in your life, from morning till night, and there's no holiday from it. And Tracy understands that. Any other condition, I've suffered from fibromyalgia for 22 years, and I at times have been unable to get out of bed and in pain such that if I touched my skin like that on a sheet, I was in agony. It never caused me depression because there was always times when I was sort of free of it. It got better. You can't forget about this for a minute or you suffer. My background then is that of someone who has found out that the health system, although it did an excellent job of catching my breast cancer on a screening mammogram, I got quickly through the breast assessment center at the Pasco Hospital, had an ultrasound, an MRI, a biopsy, got sent to my surgeon, had an excellent surgeon, had my surgery, great, at stage 1, but guess what? No one could, in spite of me telling them that I had lymphedema, my surgeon told me that she thought I had post-surgical swelling. 5 years later, more than 5 years later, I've still got that post-surgical swelling. I was also in the position, finally, a physiotherapist that I see to do with my fibromyalgia. I went in and I said, you know, my neck's sore, I must have slept wrong. She looked at me, she said, you've got fibromyalgia. Well, by this part, fibromyalgia, you've got lymphedema. It was from my fingers up to my neck, around my chest, and around my back. Then someone could tell. Well, of course, by then it was irreversible stage 2, which I didn't know at the time it was irreversible. I thought, like many patients you hear when you're getting treatments with Tracy, who are saying, how long am I going to have this? Yeah, well, guess what? Forever. So there's no way out. That's my background. So I first ended up going for the CDT for a matter of 2 weeks. Very time intensive and excellent treatment. It worked for me. It brought my arm down. But then I went and got fitted for a garment. By the time the garment came, of course, my arm was back up again. I had to go back for it. Now, for patients who don't have coverage, it's a hugely expensive process. And a lot of people I can well imagine. I view myself this way. I've got all kinds of advantages that other patients don't have. First of all, I didn't have to take radiation, which makes it worse. Secondly, I live in Regina. I'm 15 minutes from the Pasco Hospital and access to Sylvia as well, and I can afford to pay for some of that. And even so, for me, it was an overwhelming condition. I tried to teach myself the self-bandaging, and I had a good teacher in that who was very patient. I never did get onto it. I have some issues with my hands and my wrists as well. I've got carpal tunnel syndrome on both hands and arthritis in the fingers and whatnot. I found what I was doing every night, I'd have to start about 7 o'clock to do this bandaging. So here I'd be. And again, thank God, I'm right-handed and I'm doing my left hand. If it was on my right hand and I was trying to do it with the left, I can't imagine. I never did learn to do it properly. I wrapped it one time, I woke up in the morning, my thumb was huge. Okay? Now I leave it to the professionals because it's a hard skill to learn. So that wasn't doing it for me. Ultimately, I ended up seeing Tracy at the Pasco. I ended up getting fitted for the garments. I then ended up buying a nighttime garment, a reed sleeve. Again, a costly proposition, $595 each. You replace them every 2 years. I was fortunate in that when my mother passed away, she left me some money, which I fully expect to spend all of it treating my lymphedema. There's no doubt about it. One thing that I did do was buy a pump. After all of this business of, daytime garments, nighttime garments, CDT, trying to do the self-drainage, which I really couldn't do, I'd end up with aching hands and aching fingers, and if I wrapped at night, often my thumb would ache all night, in which case I couldn't sleep. Then my fibromyalgia was worse. So I had to find another way to add something else to help this. And Tracy suggested the pump. I was at the Pasco, why don't you try the pump? Of course, I've been online. What do they say about the pump? Avoid that. Well, she said this is a different pump. This actually simulates manual lymph drainage before it starts the actual pump process. So I tried it. Unbelievable. Got off the pump. I could actually stick my arm into my sleeve. I know anecdotal evidence is not considered scientifically valid, but for a patient, you can tell if when you're putting that sleeve on it, you can now get it on more easily. So it's not the solution on its own, but it certainly can be a part of an ongoing process of treatment. I found that I was going up to the Pasco about 3 times a week for treatment. There were times over Christmas and holidays that I couldn't get in enough to really maintain, and so I ended up buying myself one, as I say. I inherited some money. I thought, what better use can I have? So now, if I go to the beach, you have to try to stay out of the sun as much as you can. If I end up going for a swim, obviously you're in the sun, my arm gets a little bigger, I'll go back and do my pump right away. And often what I found is even if I'm doing the pre-therapy, I'm working on my bucket list at this stage in life. On my bucket list was to go on a cruise. I went on one 2 years ago, and of course where we went was got off at all the best beaches in the world, right? That's my idea of a good time. Well, one day, we left it too late. The bus was leaving back to the cruise ship. I'm trying to get my vest and sleeve on, and I was still wet, damp, couldn't do it. By the time I got back to the cruise ship, my arm was swollen. And I'm thinking, I'm not even halfway through this. Flying causes some problems. I've got to fly home at the end. What am I going to do? I thought, well, I've got the pump along. I'll give it a try. And I did just the pre-therapy part of it. And I found that if I did that, if that's all I could squeeze in, then I squeezed that in. But at least I had something along with me. And again, I'll be taking it next month when I go to my son's wedding. What I bought originally was the Lympha Press Optimal with the full jacket. And lately I've trialed one of the comfy sleeves, and it definitely works better for mastectomy. I could feel that as I'm using it. So I'm really grateful that the technology is improving, and I'm thrilled to think that patients who live out in wherever don't have to drive here. I mean, the roads are terrible this kind of a winter. You've got, and again, for me, this condition was overwhelming. What I was doing every night was spending half the time trying to wrap up this bloody arm, and the other time unwrapping it and rolling back those bandages. I mean, my friend Glenda and I, rolling bandages. If there's hell, they could have a section where people roll bandages all day because it's no fun. Then I'd spend the rest of the evening crying. I view myself as a pretty tough person. I really do. I'm perseverant. I'm pretty resilient. And this is the one thing that's happened in my life that just about finished me off. So I think that the system can save a whole lot of money on mental health issues if they'll treat these people. So what I'm saying to you is you're going to be seeing patients who have, if they've gotten to you to be treated for lymphedema, that's a bloody miracle to start with. Your doctor doesn't know what it is. I had to finally tell my doctor, I've got lymphedema, I need a note to the Pasco Hospital. She said, well, wait till you see the surgeon. I said, because I'd already talked to the surgeon. The surgeon said, you don't have it. Okay, no, you have to be very forthright, and you have to self-diagnose and convince the system what you've got. So I'm a lucky person. I've got my own pump. I have access to Tracy and Alyssa and Sylvia, and my life would not be doable in a lot of senses. And the one thing I want to say is please don't use the pump alone. My big fear is, and I push to have the pump throughout the province, because, as I say, it's enough of a pain driving to the Pasqua 3 times a week for me. What is it going to be, somebody from Swift Current or Yorkton or whatever? But on its own, it won't do the job. And that's my fear, is that it's a convenient option, but it doesn't work on its own. It helps, it's a piece, but it's not the whole puzzle. So I'm happy to see you all and know that there's hope for people. That's what you provide. Thank you.